Hair loss in men and women present differently. Men typically develop what's called male pattern baldness, and there might be a little frontal temporal recession. There might be some progressive loss into the crown area, and over time we really don't know. Ultimately, men with male pattern baldness will always preserve the temporal area and the occipital area. So in other words, it might look like a horseshoe, so that's probably the worst case scenario. While some men are what we call slick bald, most people begin to lose their hair and progress towards that description. A microfollicular hair transplant is performed in the following manner. Patients come into our fully accredited surgery center and are given some oral medications so that they are relaxed. We will go ahead and shave a small strip in the donor area, that is in the back part of the scalp here. We'll remove some of the hair so that we can go ahead and mark and localize. We use local anesthesia to numb that area up. After an adequate amount of time, we'll simply remove a little strip of hair so that we can dissect that strip of hair into thousands of individual, what we call microfollicular units. If we take a strip of hair out, we may transplant thousands of hairs in an individual session. We don't leave that area open. We bring the edges back together, just much like if we removed a little skin cancer or a mole, you would bring the hairline back together. So for men who want to wear their hair very short in the back, that's fine. It should be an unnoticeable scar. The microfollicular hair transplant consists of a team of people. Once we remove the donor hair, a team of people will begin to dissect those hairs into individual microfollicular grafts, and it can take hours. These treatments take anywhere from 3 to 8 hours depending upon how much hair we're actually moving or transplanting. At the same time, while some of the hair is being dissected, other team members are placing the hairs through little tiny paper cuts in the proper orientation and direction wherever we've decided the hair needs to go. Prior to starting the hair transplant, we'll go ahead and mark the area so that we're communicating very effectively in terms of where we want the hair placed, taking into consideration future hairstyles and goals for the overall session. While the hair transplant is tiring, many patients will end up falling asleep. If you want to work on your iPad or watch a movie, you can, but by the time you get into the second or third hour, there's a little fatigue that sets in from a patient standpoint, and most often patients are comfortable falling asleep on their own. At the conclusion of the treatment, we will place a little wrap around your head that usually stays on just overnight. The following day, that will be removed. You can remove that yourself, and what you'll see if we're dealing with frontal temporal recession or frontal temporal hair transplants, you will be able to see little tiny what we call crusts, almost like little scabs. Those typically stay on for about 10 days or so until they fall off naturally on their own. Our patient care coordinator will give you some instructions as to how to wash your hair during that period of time. If you want to wear your ball cap or you get out and do some activities, you certainly can. Generally speaking, following a microfollicular hair transplant, there's very little discomfort. We do give you a Vicodin if you want to take it that evening. If you want to take Tylenol, that's okay. Most patients really don't have much discomfort with it. It can be a little bit tender. Depending upon how we close the incision back here, sometimes we use surgical clips and sometimes we use sutures. And that will be very individualized, and we can discuss that with you during your consultation. After the procedure, however, as you sleep on that area, it's not painful, but sometimes it can feel a little bit funny as you're rolling over on that area. Basically, because that area is often numb, you don't have the same sensation following the treatment. That will resolve as months go by, but temporarily it feels a little bit funny back there. Following the hair transplant, after the crusts have fallen off, you look pretty good. You'll see little hairs growing, you might play with them, you'll be excited, you can see where all of the individual hairs were placed. But a short time after that, the hairs are likely to fall out. This is a normal process. What's happening is the hair is actually separating from the hair follicle. You might actually see it in the shower, but that's okay. We don't want you pulling the hair out. We'll give you specific instructions, but the hair follicle is sitting there. And while many describe this as a dormant stage, it's not actually dormant at all. It's a very active metabolic growth phase. The hair follicle is storing proteins getting ready for its eventual growth. Generally speaking, about the third or fourth month, hair will begin growth, and it will grow at about a quarter to a half inch a month as it did before. At that point, you're never going to lose that hair. That hair basically has a different genetic program because it came from an area where you weren't going to lose the hair, and that hair keeps its genetic code, and so it will always grow in the region where we placed it. From a design standpoint, many men with androgenetic alopecia or male pattern baldness begin to see frontal temporal recession and also hair loss in the crown. Many men are concerned about people sitting behind them at church or temple and because they're embarrassed with their bald spot. One of the important things to do is to make sure that we are reframing the face. And so we will spend some time during the consultative process discussing why it's important to make sure that we utilize the donor hair that we have to frame the face in the frontal temporal area. One of the things that's very important about hair transplant is making sure that the design is appropriate. We don't want to exhaust all of the donor hair in one session or multiple sessions by just filling in the crown and allowing you to continue to lose hair in the frontal temporal area. We don't want your hairline to unnaturally start back here. So an important part of the consultative process is to understand the value and the importance of framing the face and placing hair grafts in the frontal temporal area.